Hey everybody, welcome to our webinar today, The Dangers of Burning Gas in the Home. I'm Joe Wachunas with Electrify Now, here with you as always. Today I'm joined with another teammate of ours, Wesley Allen. He's been working with Electrify Now on this Clean Air Week that we'll introduce you to in just a second. We'll introduce our panelists as well in just 1 second. But welcome, and so happy to have you with us. Wesley, tell us a little bit about Clean Air Week. What are we doing this week?
Thank you, Joe. Yes, so the goal of Clean Air Week is really to highlight the dangers of indoor fossil gas or natural gas use. There's a lot of buzz and a lot of coverage on pollution in the outdoor landscapes, but we really wanted to highlight some of those dangers when we burn natural gas inside and provide resources to consumers on how they can improve the quality of their indoor air and bring together partner organizations that are really devoted to this issue. So as a part of Clean Air Week, we have an array of webinars and also a local event for those who are in Portland. So today, of course, we have this webinar about the dangers of burning gas in the home. Tomorrow, Tuesday, we have a wonderful webinar by Brian at Electrify Now on home air filtration. Wednesday, we have a webinar on home air quality monitors. And then Thursday, we have kind of a 101 presentation on how to get started with home electrification and what's the biggest bang for the buck in terms of both facilitating healthy indoor air and then also cost-wise. And then Friday, we're capping out our virtual events with the decarb policy panel. So we have about 5 different expert panelists from all over the nation talking about the latest for decarbonization policy. So that's going to be a really wonderful event. And again, for those who are in Portland on Saturday, we have the Electrify Portland Home Electrification Fair. So join us if you're here in Portland or the Northwest. All right. We also want to encourage folks to go to our website. The URL's there, or you can just Google Clean Air Week Substack. Because on that website, we have some great shareable graphics and resources. So you can see on the right, we have some little fact sheets on the different pollutants in natural gas. We also have some graphics that are that kind of make you think, that are provocative, and some different handouts from Electrify Now and other partner organizations. One of our favorite little resources or events during this week is our natural gas quit line. So we created this quit line. It's basically a phone number you call, 1-877-QUIT-GAS, and you leave a message with your email, and then we'll have electrification experts email you back with resources on where to get started or how to problem solve a specific problem you're having with your electrification journey. So please call 1-877-QUIT-GAS.
Yeah.
And now back to you, Joe.
Yeah, so yeah, please do give that a call if you have any questions about electrification. Our experts are here to help you this week and beyond. So, and we'll put links to all these events and resources in the chat as we get going. So, yeah, well today we're going to be talking about the dangers of burning gas indoors. We're going to talk about, what are the pollutants in natural, what are the pollutants in natural gas combustion and what they do to the human body. We're going to be looking at the latest in current research on these harmful chemicals and which natural gas burning appliances emit the most pollution. We're going to look at ways that you can, if you have gas appliances in your home, you can still try to clean your air as much as possible. And to join us in this great webinar today, we have 2 fantastic panelists. We have Dr. Eric LaBelle. He has been no stranger to Electrify Now. We've been lucky enough to have him on a couple of great webinars over the years. He graduated with a, he graduated from Stanford University, where he did a lot of great research that we featured on our webinars as well. It focuses on the emissions of methane and health-damaging air pollutants in California. He specifically studies abandoned oil and gas wells and residential appliances. and he's worked to develop new methods for quantifying these emissions, and he's designed and executed research campaigns to systematically quantify emissions of methane and other pollutants throughout the state. Eric has been at PSC Healthy Energy since 2020, and he's going to kick us off with just a look at some of the different chemicals that his research has been on that are emitted by natural gas in our homes. And then we're going to follow Eric with a presentation from Dr. Curtis Norgard. He's a pediatrician practicing in the Minneapolis area, and he's assistant professor of pediatrics at the University of Minnesota Medical School. He regularly discusses environmental health problems with families in clinics, and he studies the way that natural gas impacts our health and our environment. So we're super excited to have both of these fantastic panelists today. Feel free, as they're sharing or getting their slides ready, feel free to put your questions in the Q&A. That's easiest for us to track, and we'll keep an eye out. So they're going to do about 15-minute presentations, and then we'll do about 20 minutes at the end for Q&A. So Eric, thanks so much for being on, and same to you, Curtis. And we will, look forward to hearing your presentations.
All right. Hopefully everyone can see the slides, and if you can't, let me know. But thanks,
Yes.
Joe and Wesley, and glad to be here as a panelist today to talk about some of our recent work on the health and climate pollution from gas appliances. We'll be giving an overview of work that we published in the last few years, particularly as it pertains to the health and climate impacts from gas appliances in homes. So, as Joe just mentioned, I work for PSC Healthy Energy. We're a nonprofit energy and science policy research institute, and we're headquartered in Oakland, California, but we have staff all across the United States. Our mission is to generate science-based energy and climate solutions that protect the public health and the environment. And as Joe also mentioned, I was a PhD student at Stanford, and some of this research was done also during the times when I was a PhD student there. And so special thanks to all my collaborators and co-authors from that period as well. So here's an overview of my talk today. We're going to talk about each of these in turn, but we're going to basically we have split up into two different types of impacts that we want to talk about. The first is gas leaks, where we are looking at emissions from gas appliances while they're off, and also from leaks in other gas systems throughout the home. All right, those will all be contained together, and we'll talk about the health and climate impacts of those types of leaks. And then the second part is what happens when you turn your gas appliances on. How does that impact your health and climate due to the emissions from those appliances when they're turned on? So we'll start with climate. So looking at each of these in turn, the climate impacts from natural gas appliances in particular boil down to the carbon dioxide that they emit from burning the gas. As everybody in this call probably knows, natural gas is a fossil fuel. When you burn it, it produces carbon dioxide, which is a greenhouse gas that contributes pretty significantly to global warming. But there's also the natural gas is made up mostly of methane, which it's also a climate gas, a greenhouse gas, and it's much more potent than carbon dioxide, about 80 times more stronger over 20 years. So it's important that we don't emit methane into the atmosphere unburned. So just talk about a bit overview about the distribution of gas appliances and gas use in the U.S. The total amount of gas used in your typical home in the U.S. Obviously this changes based on location, but an average home in the U.S. uses most of its gas for space heating and water heating. Only a small amount is used for cooking or other. Other gas uses in a home might be like pool heating or gas grilling, for instance. But the number of appliances are much more evenly distributed. You can see that there's most people have space heating like furnaces or water heaters. Many people also have cooking appliances, and then there's a variety of other appliances that people also have in homes. In total, there's nearly 190 million gas appliances in U.S. homes, and those appliances use about 3.8 trillion cubic feet of natural gas per year, all of which will convert into carbon dioxide, and then there has a potential for the methane to emit unburned. So first, I just want to talk about some of our work we've done with water heaters, in particular looking at the difference between storage water heaters and tankless water heaters. What we found is that for storage water heaters, overall they emit less methane emissions. So this is now just methane emissions from unburned gas or incomplete combustion from these appliances. Many storage water heaters have pilot lights, and what we found is that the bulk of the emissions from storage water heaters are from the periods in which the appliance is not even being used. So that's likely from pilot light emissions or other ambient leaks that are happening near the appliance. But meanwhile, for tankless water heaters, they emit overall more methane on an average use case scenario. And most of those emissions, about half of those emissions, come from periods in which the appliance is switching from off to on or on to off. And about a quarter each is emitted while the appliance is off or while it's just running. So, but we also know that tankless water heaters are more efficient than storage water heaters. And so, just to show now how that stacks up with CO2 emissions, just burning the gas from a typical storage water heater will increase the total greenhouse gas impact. So this is now just normalized to total greenhouse gas impacts in CO2 equivalents. So the tankless does emit more methane, but it also emits less CO2. So that's just one of the things that we found when investigating water heaters. Is that while it does emit more methane, it does the savings from CO2 just still offsets the savings in total greenhouse gas emissions. We also did some work looking at stoves and ovens in a similar way. And what we found here is that the total emissions from methane from stoves and ovens also come from periods in which the appliance is not being used. We found that about three-quarters of the emissions were attributed to that period in which the stove or oven is not even being used. The remainder is split apart periods in which they're on, when it's turning on and off, or when the oven is being used. And how does this compare to CO2 emissions? Well, it does increase the total CO2 emissions. And the methane emissions alone we calculated from stoves in the US have this similar climate impact as CO2 emissions from driving 500,000 cars. And that's just from the methane emissions from the gas stoves. And how that calculates across the US. And that's from the about 40 million gas stoves in the US. So now I'll switch over and talk a little bit about the health impacts that we've measured now from these gas appliances. A lot of the health impacts from gas appliances originate from the gas stove. Unlike the water heater or furnace in your home, which does use more gas, the gas stove is typically inside your home and inside of your kitchen where people spend a lot of their time. A lot of gas water heaters and furnaces, for instance, don't have are in like a garages or outdoor sheds. So even if they and they're also have dedicated vents typically to really expel the gas from the combustion of the appliance outside. Um, we do know that there are some risks for health for gas water heaters and furnaces. That's mainly due to like carbon monoxide issues with like backdrafting in vents, and less an impact though on indoor air pollution otherwise. So we'll talk mostly about gas stoves for indoor air quality in terms of emissions from gas appliances. So what we know is that gas stoves can create air pollution when they're used. We've measured this time and time again for variety of compounds. And so what we want to know is while they're being used, you know that there's a plume of gas that gets emitted into the home. If without ventilation, that stays in the kitchen and spreads throughout the house. And so we want to understand what is in this plume of gas that's being emitted into a home. So we'll start by talking about nitrogen dioxide. This is one of the most heavily studied compounds from the health impact of burning gas, particularly from gas appliances in homes. One of the things that we found in our research is that burning more gas generates more NOx, which shouldn't sound like a surprise to anyone because that's how NOx is formed. We know that NOx is generally formed at higher temperatures. And so burning more gas or using more burners creates more pathways for that NOx to be formed. We're concerned about NOx from a health standpoint. It's consistent mainly of NO and NO2. I'm sure Curtis will tell us more about this during his talk. But just in short, the NO2 is a respiratory irritant and is linked to asthma, particularly in children. So what we found though is that burning more gas will generate more NOx, and this was demonstrated across all the stoves that we measured for gas NOx production from gas burning. Here's some results from different homes in which we turned on different burners and watched the NOx spread throughout the kitchen and throughout the house. So this is comparing in the kitchen, what the difference between using a hood and not using a hood looks like. So this is the same scenario where we turned a burner on and watched I think this one was oven measurements. And so what we saw here was that using a hood, which is the red trace here. This is the time since the start of the test, and this is the y-axis is the NO2 concentrations. So turning a hood on will reduce the total amount of NO2 that is present in the kitchen, but it doesn't completely eliminate the NO2 in that kitchen. You can see that the having the hood off creates these higher spikes, but an overall higher concentration. But having the hood on does not completely eliminate that source of NO2. Similar here, this is now one gas oven and three burners are on in a different house. And you can see the similar results from the trace here. Having the hood on in fact, has a bit of a higher than hood off here, but still, it just depends on the efficacy of the hood in particular homes. But in general, we find that having a hood on slightly helps, but doesn't solve the problem. Similarly, we found that NO2 can spread throughout a house. It doesn't just stay in the kitchen. So this is the results from 6 different houses where we had the oven on for an hour and a half and then measured the NO2 concentrations in a bedroom over the course of 5 to 8 hours. And what we find here is that even with gas or propane stoves, having the oven on will obviously increase the NO2 concentration inside the house, and that will spread throughout the house into the back bedroom that we're measuring here. And once the oven goes off, there's a decay in the concentrations over time. But I think what's important to note here is that it's not just in the kitchen where we're seeing these concentrations of NO2. It spreads throughout the house and in many cases even exceeds the US EPA and WHO 1-hour health guideline of 100 parts per billion, even in the bedrooms of the house. Now I'll talk a little bit about benzene measurements. So this is now benzene from gas appliances while they're being used. So similarly to the NO2, we found that benzene in this case, it's a partial incomplete combustion product. Unlike NO2, it's not emitted from every single gas appliances that we measured, but in some cases it is emitted in large quantities. So what we've measured here is we've tested 4 different types of appliances. So we have induction coil burners, we have regular natural gas burners, and then propane burners. And these are the benzene emission rates from burners on high. And what we find is that gas and propane stoves do emit benzene, and that induction burners emit undetectable levels of benzene emissions with electric coils having very small levels of emissions from a gas burner on high. And how does that translate into concentrations throughout the house? Well, here's a plot of different individual kitchens where we measured individual burners, either an oven, a gas oven burner, or a cooktop burner, on for 45 minutes, and what the resulting benzene concentration was in the kitchen. So as I said, there are many kitchens where there's little to no emissions from the burners, but there are some kitchens, such as these kitchens on the right here, where the concentrations of benzene in the kitchen are high and exceed in some cases the California 8-hour reference exposure level of 1 part per billion benzene in the kitchen. Benzene is a known reproductive toxin and known carcinogen, and so we definitely need to keep those levels as low as possible from the emissions from gas appliances. Oops, sorry, that was 2 slides. And similarly, what we also found is that the benzene, like the NO2, also spreads throughout the house. So this is measurements of benzene in the back bedroom of a house when with just the oven on being on for an hour and a half. And what we find here is that in some of these situations, the benzene only goes up a little bit or not at all. And in some cases, it's still exceeding that California 8-hour reference exposure level of 1 part per billion, even in the bedroom of the house. And this happens for both gas and propane stoves. And then lastly, I just want to end by talking a little bit about benzene emissions from gas leaks. So not only are we seeing benzene from gas appliances while they're on, but we also see benzene from gas appliances and from leaks in homes while they're off. And this benzene comes from the gas supply itself. We found that the gas, while is not just methane, but it's a big chemical like a pizza sauce of compounds, right? There's methane in there, but there's all kinds of other little ingredients too. And one of those ingredients is benzene. It's maybe left over from the production and of the gas, but it's still present even at the site of end use. So you can think that we're sampling here in this picture. This is someone's gas stove. The gas burner is not even on, but this gas is basically literally the end of a pipeline that's traveled hundreds, if not thousands, of miles from a production field to your gas stove, and we're measuring what is still in the gas. And what we found across 17 cities now in North America that we've measured and published about, that we found that benzene in nearly every sample of the gas that we've measured. And we've measured now over 700 samples across all these cities. Some cities have higher concentrations of benzene in the gas than others, particularly those in the western half of the continent of North America. And what this means is that if you have benzene in your gas, if you're exposed to a gas leak, even if the gas stove is not even on, there could be emissions of benzene from the gas supply into the home. Now, just to put it in comparison to what we found with the gas stove being on, we do find that in nearly every case, having the benzene emissions from the gas stove being on are much more of the greater piece of the puzzle compared to the emissions from the gas stove being off. But we want to, make sure that we find all the different sources of health that we can inside a home. And it's for something like this, it's not just the gas stove, but at any point where gas may be leaking into your home from, could be from the gas fittings and the piping infrastructure, or from other appliances in the home that may be leaking into the home as part of those off emissions, which seem to be very prevalent. So I'll just end with a few takeaways here. So we found that that gas is emitted from different types of appliances, both while off and while on, and those have both climate and health impacts. So what are some of the things that can be done when it's time for a new appliance in your home? Consider electric, which our data has shown that doesn't have as many emissions, both from climate and health perspectives. In the meantime, if you don't have the means to immediately switch to a cooking gas or electric appliance, some things that you can do to shift your cooking load to minimize the NO2 and benzene production from gas appliances while they're on, like using a kettle, crock pot, or a portable induction burner, for instance. But if you do use your gas stove, make sure you always use the ventilation hood to help reduce some of those concentrations in the kitchen, both of benzene and NO2, but knowing that it is not completely effective. And if your ventilation hood recirculates, or if you don't have a ventilation hood at all, it's important to open a nearby window when using a gas stove. And I'll leave it there, and I'm happy to answer questions after Kurt's talk, and thanks so much for listening.
Thanks, Eric.
Here's an acknowledgement to co-authors and collaborators. mainly from Stanford University. We had some collaborators from the Central California Asthma Collaborative for some of these research measurements. And then here's a list of citations for the different papers that were talked about in this study.
Great. No, I appreciate that. And we will send everyone a copy of these slides so they can read more in depth about the amazing work you've done. Maybe, Curtis, you're pulling up slides. A quick follow-up question for you, Eric. Doug is wondering, have any other labs, replicated the benzene and NOx measurements that you all kind of showed
I
sometimes?
haven't seen any replication of benzene to this point. When we did the benzene measurements, it was benzene is a lot more tricky to measure inside a home. We were able to use a new type of analyzer that allowed the portability and levels of precision that were needed for those measurements. But I haven't seen any other studies come through yet that have replicated the benzene measurements. The NO2 measurements have been studied for decades at this point. We were one of many studies that have shown that. But NO2 from gas stoves is actually very well documented, and our results are generally in line with other studies that have shown similar levels of emissions and concentrations in homes.
Okay, cool. Well, thanks so much. Let's leave it there, and we'll get to more questions during the Q&A. Kurt, thanks so much for being on, and yeah, we can see your slides. Great.
Perfect. Yeah. Well, thanks for the opportunity to speak on this topic today. I had a little trouble with my internet earlier. It seems like that's resolved, so bear with me if anything comes up again. So I'm going to follow up with Dr. LaBelle's comments by talking about how the pollutants are formed from burning natural gas and what we know about how they impact our health and some of the lessons we can take away from ongoing research and some things that we might see in the future, and then again, a little bit more about what to do about the emissions. So if I can get this to work here. There we go. The basic reaction when we burn natural gas is converting methane from CH4 to CO2 during combustion, and that's actually an oxidation reaction. And it's, of course, much more complex than this, starting with what we've already heard about, that the fuel itself is a complex mixture. Again, the CH4, the methane, and the CO2 are greenhouse gases, but some of the other things in natural gas, ethane, are relatively inert with respect to human health, whereas others, as we've heard, benzene in particular, is quite concerning. It has a number of health effects that we've already heard about, including it's one of the known causes of blood cancers like leukemia. So if that's released into the environment, then that is a potential exposure that could affect our health. Now, once those chemicals and gas, including the methane, are burned, they go through many steps in the combustion process, many chemical reactions. And one of the things that can happen is this chemical can form when you get the first step of oxidation. You add oxygen to the methane and you get this formaldehyde. And some of it will continue to combust and some is released into the air around your stove. And that's important because formaldehyde is also a known cause of certain blood cancers, as well as cancers of the airway. It's also an irritant for the airway. If the combustion process proceeds and you get more oxidation, you get carbon monoxide. And obviously we know about carbon monoxide poisoning, and that can be fatal. But what we probably don't appreciate is that in cases where it's not fatal, people often end up in the emergency room. And that's because of either the neurologic or cardiac effects of carbon monoxide. So it is toxic for both of those systems. And in fact, if you get to the ER with carbon monoxide poisoning, they're going to do an EKG and do blood tests to evaluate the heart damage from carbon monoxide poisoning. And I've seen children in clinic with really what I'd call subacute cases of carbon monoxide poisoning that after the fact, we realized that that was the source of their symptoms, that they complained about headaches and dizziness, for example. And in public health studies, the changes in carbon monoxide in the outdoor air have been associated with higher risks of heart attacks. So even though I won't talk more about that pollutant in this conversation, it is important. Then there are a whole host of chemicals that can be produced. As we heard, benzene is actually also produced during the combustion reaction along with other chemicals. And those are considered a complex category called volatile organic compounds. some of which, again, are relatively inert for our health and others are very important. So once the oxidation or combustion process is complete, of course, we end up with CO2, and as you know or have surmised by now, we get other things like the nitrogen dioxide. And NO2 is produced by any time you burn anything in our atmosphere. And so natural gas is no exception. Then among all of the constituents of this combustion process, some of them combine to form particulate matter, and some of that will be the PM 2.5 that we're familiar with. But actually, if you look at the pattern of particles released by burning gas, there are far more ultrafine particles than the PM 2.5. And that and a lot of the VOCs, we actually have really no idea of how they impact our health. We're just learning about how much is being produced. So I'm going to go now talk about health impacts and specifically the nitrogen dioxide that we've learned a lot about already. And that, again, as Dr. LaBelle mentioned, I'm going to talk about it because we know the most about it as the pollutants that come from cooking with gas and its relationship to health, specifically pediatric asthma. So being a medical doctor, we do a lot of our education and training by reviewing cases. So this is a pediatric case. This is somebody that I care for. I have permission to share this today, so no HIPAA concerns here. And this is a boy who, when he was younger, had asthma that was mostly triggered by just cold viruses. And as he got older, he outgrew that, with very few exceptions, a little ragweed seasonal symptoms. But what was really striking about him, in my mind, is that when he went with his family on a trip to a vacation rental, and this property, by the time he showed up, he was feeling totally normal. The property seemed fine. It wasn't very dusty. There were no mice or cockroaches or mold, things that would otherwise trigger his asthma. And by the time he left, he was in nearly emergency situation. He was wheezing consistently. He was becoming short of breath. They had no inhaler because he hadn't needed it for ages. And if you talk to him and his father, who were with him on that trip, and I can verify this because this is my son, and this was a real experience that happened to us. This vacation rental had a gas stove. I would have never cooked with one otherwise, but it was in a small kitchen, a confined space with terrible ventilation, and the fumes from this were incredible. So I noticed that at the beginning of the trip once we started using it, and then I just was really shocked to see what happened to my son over the course of this trip. So it's a personal experience. But I do think for me, it just really brought to life the reality of the data that we're talking about here. And, we know the story already here. You make the pollution by burning gas in your stove. This is a real world tracing from someone's kitchen. Dr. LaBelle's are much more professional, their research. This is like I'll talk more about this later, but this is an NO2 tracing. And we're exposed to that. And then that can cause symptoms or contribute to the formation of asthma. And I'm just going to make a side note here. Is this, what is the level of confidence we have in this relationship? I would say it's strong. There is still some back and forth about this, but I would side with, so there's a couple of references here that you can look up later. But this last one here from 2024, the authors end pretty clearly concluding that there is a relationship. And I'll tell you, as a medical provider, the American Lung Association, the American Thoracic Society, that includes a lot of pulmonologists, the American Medical Association, and so on and so on. All of these medical professional societies have officially recognized this as a problem for our respiratory health. So before I go to the next slide, I just want to bring us back to this tracing here in the middle, the NO2. And what I want to say is that some of the back and forth that you might have heard about, or some studies that didn't all find a relationship between NO2 and a health outcome, it might be at times due to the fact that studies are limited in resources and ability to measure things. Researchers might look at homes with stoves and not measure the NO2 inside the home. And we know from a lot of studies that things like the size of the home, the ventilation, the amount of pollution generated, those all impact these concentrations. And these are really what's driving the health impact. So I would say that's probably part of what's going on in the pediatric world, because not every single study has found a strong effect. But in the adult asthma world, or in the literature on adult asthma and gas cooking, I would say that I really think is part of what's going on. And that's partly based on work that I've been doing with some colleagues. We were preparing a study for publication and that looks at adults with asthma using a national health data set collected by the CDC. It's used for a lot of health studies. We looked at all adults with asthma, and we wanted to know whether they were more vulnerable to the pollution from gas cooking. And so we looked at their responses. Did they cook with gas, yes or no? And if we look at all adults, then we found no clear relationship. It didn't seem like it made much of a difference. But as I just went through, if we looked more carefully at certain populations or certain scenarios where the gas pollution may have had a stronger impact, then we did find a relationship. So for example, people who have asthma and smoke, and those people really exist. You might think if you had asthma, you wouldn't smoke. That's not true. This is a real population of people in the US. We shouldn't dismiss them out of hand. And when we looked at that population, if they had cooked with gas, what we found is that they had about twice the risk of an asthma-related emergency room visit in the past year. So in that case, there was a really clear difference in the relationship. If we looked just at adults with asthma who smoke, and just between them, did they use a stove, gas stove, yes or no? And that's very different than looking at all adults. Similarly, if we just look at renters with asthma, people who rent are more likely to live in smaller residences or residences without proper ventilation. If they cooked with gas, there was some evidence in our study that they were more likely to have asthma attacks. We were limited by the data set. It didn't have enough records for us to have a really robust analysis. So we think if we had more records, that would have been statistically reliable. And similarly, if we looked just at people in the survey who identified as Black or African American, if those people with asthma, if they had cooked with gas, they had about a 50% increased risk of having an asthma attack in the past year. And that's statistically reliable. And what we've seen looking at the literature is that not a lot of studies have looked carefully at these subgroups, right? So people, we know that the impacts, health impacts from pollution aren't equitably distributed, right? There's an environmental injustice that people of color are exposed to higher concentrations of pollution. They experience greater toxic stress in their life in general. And those and other reasons, access to healthcare and so on, may be a part of why they seem to be more impacted by the use of a gas stove in the home. So the takeaway I would say here is we have to think very carefully about what we're measuring in these studies. And if a study claims there's no relationship, then for us to dig a little bit deeper and try and understand why. The next thing I want to talk about is, another health outcome. We've talked about pediatric asthma has the best evidence. We're still working through the evidence on adult asthma, but actually, if we looked at outdoor air pollution, and especially at nitrogen dioxide that we know is coming from our stoves, there are a lot more health outcomes associated with it in the outdoor research world. And that's probably because there's just been a lot more work done on outdoor nitrogen dioxide. So what we can do is think about whether that might be relevant for the indoor air as well. And so I'm just going to walk through one example. And this is really more of a thought exercise. This is not saying that this is exactly what's happening, but something that might be worth thinking about and studying in the future. So for this one study that I'm referencing here, they looked at the nitrogen dioxide impacts from cooking with gas, and over an average period of time, homes that had a stove for gas cooking had about 8 parts per billion more nitrogen dioxide than those that didn't. And if we look at one of those other health outcomes that for outdoor NO2 has been clearly associated with that kind of pollution, preterm birth. So if a mother or a pregnant person is exposed to higher concentrations of NO2, they're more likely to deliver a premature baby. And the number or the size of that impact is pretty interesting. So in one overview of that relationship, if for about a 5 part per billion increase, that resulted in about an 8% increase in preterm births. So if you compare the size of these pollution impacts, they're really in the same neighborhood. We're not talking about a really big impact outside and a small one in the home. They're actually, in this comparison, they're not too different. And there are a lot of reasons why we can't just immediately conclude one follows the other, but I think it's a way for us to come up with hypotheses and think about some other ways that cooking with gas could impact our health. And, beyond that, there's another way to think about gas, I'll say, beyond just a pure health point of view, and that is we can consider natural gas as a housing quality problem, something that is also not really done yet. And at this point, we don't think about gas in preterm birth. We don't think about gas necessarily, I think, as a housing quality issue the way we do thinking about something like mold. So another thing that we're doing is looking at natural gas code violations in the city of Minneapolis. The city does a good job of tracking these. And so we've used some of their tools to do some preliminary mapping and are now doing a more in-depth analysis. But we looked at where these natural gas code violations occur in the city, and they're not uniform, they are clustered. And one of the things we want to do with this analysis is try and understand where these are happening and what are the associations with these locations. And so one of the associations is definitely race and ethnicity. So the city has a tool we can use to map either white or conversely people of color. And you can definitely see this overlap here, that census tracts in the city with lower proportion of white or conversely more people of color living in those tracts are the ones where these natural gas code violations are occurring. And in terms of health, there is also a potential relationship because we can also look at asthma or COPD is the same. Asthma and COPD rates in these same communities, and the rates are higher in those same communities where the natural gas code violations occur. So what we know here is if you have a pre-existing respiratory condition, you are more vulnerable to the impact of air pollution. There's also a question here about economic or environmental injustice. And I wouldn't argue, at this point, we're just looking at these as associations. So it's very possible if we do find one that in the final analysis that the communities that have a higher burden of respiratory disease are the ones that have a higher burden of these natural gas code violations. So that's another important thing for us to think about, I think, with housing quality and how it impacts, natural gas impacts our communities. So I'm just going to say a couple things to wrap up about what we can do about this and how we can institute change. So I'll also have a slide about the individual actions. And of course, system level change, organizing, policy actions are also very important. But actually, I think there's a way we can kind of bridge those, the organizing and individual actions. And that's through this idea of an indoor air quality monitor lending library. So in Minnesota, the organizations that I work with, we've worked together to come up with this idea that we purchase a reasonably performing indoor air quality monitor. Either it's definitely not or probably not research grade, but what we do think is that these do a reasonable job of measuring the pollution that comes from burning gas. And we want to bring these into people's homes and show them what happens in their own home when they use their gas stove. And a lot of the motivation for that is because not everybody can follow along research studies or wants to or takes the time to learn about this research the way that you all have. So you're all a very unique group and unfortunately not representative of the broader United States. But what we found is that if we bring these into the home, and it's a lending library concept, so we don't buy this and give one to everybody, but we bring it into the home and let people try it out. We get a couple of different kinds of outputs. These are real-time tracings that as people use their stove, they can see, they can log into an app, we can show them in real time at their home We go back and visit with them. We meet with them and show them what happened. And people remember this. They log down. Okay, we encourage them to keep a log, and they say, "Oh yeah, I cooked a holiday meal. I did a big stir fry. I used my oven," and they go back and see this, and they can visualize this way what happened to their air quality when they were cooking. And it really has surprised me to get feedback from people who have had this experience and hear what they say about it. Some people, the pure act of measuring pollution in their home already triggers a lot for some people. So it's absolutely fascinating. I think it's an incredible way to drive change. And I would be happy to talk more to anyone about this. And we're having great success, I think, really changing the way people think about gas. So, just to reiterate what Dr. LaBelle said, the number one thing is to eliminate the source of the pollution. And induction's great. We have like the dual version of this thing that we've used for like 3 years because our stove is impossible to replace at this point. It's worked great. And ventilation only works as good as the actually getting it out of the home, and it's really imperfect. This is probably what a lot of people renting have. And then for ventilating, opening a window is like great. If the air quality is good, you've got nice weather outside. And especially here in Minnesota, we're in a part of the country where the amount of bad air days from wildfire smoke has just changed. It's nothing at all like when I grew up here. Some days are really terrible and almost look like this. And it becomes more complex. A lot of days, like right now, you would be better off to open your window, but other days you absolutely would not, because the amount of particulate pollution from the smoke is horrendous. And it's just like, why don't you just get rid of the source? And then you don't have to worry about it. All right, so I'm gonna end my remarks here and stop sharing here. Okay.
Great, thanks so much, Kurt and Eric. That was really great. Really appreciate both of your presentations. Yeah, so let's get into some Q&A. Maybe we can start right there with that open window, because that came up in both your presentations and in the chat. And maybe you could both just comment on it doesn't seem, Eric, from your presentation that venting is all that effective, especially with NOx and benzene. Is it some of the viewers are wondering, is it a combination of venting and then opening your window if the air quality outside is good? That's the top recommendation if you have a gas stove, other than using electric appliances. Should folks be doing both of those as much as they can?
Yeah, so the venting, the data I showed was just from a few individual scenarios, and I did, even for with it among the vents that vent the air outside, there's still a huge range of quality. Like you have the microwave vents, and you have some of the ones that are lower power, like the one that Dr. Norgard just showed in the house. But then you also have like the near commercial grade ones that are sound like jet engines, and sometimes you turn them on. Those are gonna be more effective, obviously, than not. Also depends on the placement of your stove. If you have an island stove versus like against the wall, I've seen that the research has shown, not my research, but others shown that it's more effective venting the back burners than the front burners, because it's able to capture the emissions better. So there's a lot of different factors that go into it. Um, but yeah, I'll leave it at that, I think. But yeah, if you don't have the vent option, as we just talked about, Dr. Norgard just pointed out very astutely too, that just if you have to check on what the outdoor air quality is, because if it's worse than inside, you don't want to open your window. But if it is better, then that is another option that you have as well. But
Great.
I'll say this, sorry, one more thing, is turning the fan on, the hood on, will also, like, you are sending air outside the house, which will come back in the house. Maybe it's not going to be through an open window, but it will come back in through other cracks and whatnot in your house in some way. So it's not going to be all in one spot, but you are letting air inside your house by turning the hood on.
Yeah, and that actually, we're going to follow up with that. The air going out's got to be replaced with air coming in from somewhere. And the only system that really would address that properly, at least to some degree, would be if you had some kind of fancy exchange system that had a really good HEPA filter, and then it's not going to filter all the pollution like coming from the outdoor air. So, and you can imagine if you had a really old leaky home or apartment, it kind of acts like ventilation system, you clear out your kitchen faster, but then you're bringing in the outdoor air faster too. So in my experience talking to families about air quality, which I do way more of now than I used to, and I find there are varying degrees of sophistication in terms of people's understanding of outdoor air quality. And I think we should talk about it. And we can still use windows for ventilation because especially gas cooking is a lot of the time is such an acute exposure. Like, yeah, some of the time you might be better off just getting a little bit of the outdoor pollution because the inside's going to be bad enough. But even that's like a pretty complicated thing to try and understand. And I think there's just a limitation between the things somebody said in the comments, like, well, let's say you live near a busy highway. Well, yeah, a lot of the time your air quality might not be that great. The easiest thing is just instead of, well, yeah, trying to understand the outdoor air quality impacts better, but also just get rid of the indoor source.
Thank you, Dr. Nordgaard and Dr. LaBelle for those answers. Yeah, it's so interesting to think about that interrelation between indoor and outdoor air, and it's not one of them isn't the problem. It's both. So there are several questions in the chat about other appliances that use natural gas indoors. And the sense I get is that predominantly the research that's being produced right now is on gas stove use indoors and the health effects that that has on the human body. Um, Theoretically, can you chat a little bit about what might be some of the problems with other gas appliances? Some folks mentioned gas fireplaces. Another mentioned gas wall heaters or burning pilot lights for these different appliances. And of course, we have gas water heaters that you talked about the climate impacts for, Dr. LaBelle.
Sure. So that's all great questions. I would start by saying I think the gas stove is unique because every gas stove is by nature is going to be inside your house, and it's not going to have an automatic vent that is dedicated to come on and effectively capture all the pollution every time you turn it on. You have to do that yourself, right? If you even have one to turn on. All the other gas appliances in homes that I'm aware of, with the exception of ventless wall heaters, which do exist in some places but are illegal in others. But all the other gas appliances that were mentioned, like water heaters, whole home furnaces, fireplaces, as far as I know, those all have dedicated vents that go with them. And in many cases, like the furnaces and water heaters, they're not in a spot in the house that people typically spend time around, or like they're in a garage or a basement that's a separate zone from your house than the part where people live in. And they all have dedicated vents. So we haven't seen any extreme impacts from properly operating appliances in terms of the NO2 or benzene, or any other types of pollutant. We always measured some carbon monoxide. Haven't published on that yet. Um, but that's not to say that there's no issue with those. I think everybody's probably aware, especially with water heaters and furnaces, you have the issue of carbon monoxide backdrafting into your house, right? Like you have the flue is not working correctly. You have some sort of plug, and the carbon monoxide is backdrafting into your basement. So that's why it's important, if you have a gas appliance, to always have a carbon monoxide detector nearby for your own safety, right? Like that's a life or death situation in some of these cases, and something you're not going to know otherwise. Um, but in terms of NO2 and benzene, we haven't looked at it that closely, just because it doesn't seem to be as much of an issue as the stove is by default.
And maybe just building on that, that was great, Eric. But Curtis, you were talking a little bit about the natural gas code violations that yeah, like you're saying, we haven't seen many studies on how many of these water heaters and furnaces are backdrafting and malfunctioning. I'd be curious to see what kind of data there is. But what do those natural gas code violations look like? Is it improper venting? That's kind of broad category. Have you seen what are some of these code violations?
Yeah, great question. So the city has a handful of individual code violations, and some of them are related to leaking pipes, gas pipes, which is extremely concerning. that the city came out and found these and cited someone for it. The others are related to repair or replace an appliance, so a water heater or a furnace. And we we would like to do like a FOIA type request with the city to look at some of the original citation paperwork to see what we can get from them, more details. But we don't, beyond what I said earlier, we don't actually have more information than that. So there's this first analysis, there's going to be a limit to what we can infer about the air quality impacts. So a furnace might be malfunctioning, but it might not lead to an air quality impact. Like if it just broke down and someone called the city and said, the landlord hasn't replaced my furnace yet, the city could cite them, for example. So it really is an exploratory study. And I think the main point of that, the primary point is going to be to reorient our thinking about natural gas appliances as being in that same category of other housing quality problems, that these are things that are breaking, that are impacting us in maybe multiple ways. And the burden of that is really the way it's distributed, at least in Minneapolis, is very concerning from a justice perspective.
Great points. Wesley, you got that? Go ahead.
The other piece I just wanted to add too, back to the original question too, is we haven't talked much about outdoor air quality from these appliances as well, but there is something to be said, especially in highly dense cities, from all these, because so these appliances, the water heaters and the furnaces, they do produce NO2. We know that from just because all gas burners produce NO2. In some level, because it's how from the heat and the combustion process. But in urban areas like that, the NO2 does add up to a meaningful contribution to outdoor air quality from buildings, and that's something that should also be considered as well. Even if it's not directly impacting indoor air quality, it is impacting your air quality.
Mm-hmm. Yeah, thanks for that. And actually, at our policy panel on Friday, there's going to be a lot of discussion about that interrelation between indoor air quality and outdoor air quality, and how policy affects some of the decisions that different governments might make, or jurisdictions. So we have a couple questions, or actually I have a question, and we have a question from the chat from Brian about indoor air quality monitors. I just think that is so cool, Dr. Nordgaard, that there's that lending library. What a neat tool and kind of citizen science to have around. Is there a way, do you have any recommendations on how other cities or organizations can replicate that, to have an indoor air quality monitor lending library? And then also Brian had a question about there's an availability, a general availability, pretty cheap, of air quality monitors that measure PM 2.5 particulate matter. To what extent can we use that as a proxy to deduce, like if it's producing this level of PM 2.5, then we can assume it's producing unhealthy levels of benzene or formaldehyde or whatever it may be.
I love it. Let me first say the number one source of PM 2.5 from cooking is frying. It's not your gas stove. So that we have talked to people about that. It's very complex to convey to people all the different pollutants, how they're formed, and the PM 2.5 is, it's difficult to get that across. But I'll say here, that's not the number one pollutant from the gas stove. And it's coming from frying, and not to downplay it, but measuring it in a home monitor, that's not going to be that helpful. The other options, if you don't get, it's because NO2 is really hard to measure correctly. And so the consumer level devices, they're really limited. I'm just sending a reply to somebody here. The TSI AirAssure seems to do a better job of measuring that than the other device we've used. The other one I would not even, it's not very reliable at all for NO2, but it measures a lot of other things. So your choices are CO2, which is a little bit complicated because people are emitting it when we breathe, but it definitely is bumps up when you're burning a stove, when gas on a stove and not an electric. That's a reasonable proxy with that caveat. VOCs, there are a lot of monitors that can measure real-time VOCs, and that's not so bad because what we're seeing with deploying these monitors in the real world is that they're mostly bumping up from gas cooking and not from electric cooking. Again, it's probably because of those combustion or incomplete combustion products are the major thing being detected by those sensors. And there's a lot of nuance into interpreting those, but if you want to show someone the pollution going up and then going back down, that's not a bad choice. And then the final one would be carbon monoxide, but what I think for the real-time monitors, that's a little bit tenuous. I'm not sure that they're doing a great job measuring that, but it would be specific to gas cooking as well. So CO2 and VOCs are an option. This TSI air assure. So you buy one of these. The Yoo-Hoo is $200 or $300. TSI air assure is $1,000. So you need a funding source, and you just bring it to a home. And there's all permutations. People do this all different ways. And the one thing I will say is, the one challenge that we can't get over is a lot of people want someone to tell them, what does this mean for our health? And that is hard to come by. So I would say the program's easy to do with that exception. It's kind of hard. People have trouble letting go of that and not having that part of the program.
That's great. Okay, well, thanks for that. Yeah, helpful dive into the different types of air quality monitors. And we're going to be doing a little bit more of that tomorrow. Yeah, so maybe as a final question, as we are at time, if you are coming at this from an air quality perspective, you have, like Curtis or myself, we have a child with asthma, or you really are worried about, a lot of these pollutants that you all have been illustrated today. What's the roadmap for cleaning your air as quickly as possible? What should folks tackle first and prioritize? I think we have an idea of that answer, but maybe we can succinctly say that to folks. Whoever wants to start with that, but I'd love to hear both of your thoughts.
Well, it depends if you're talking about health or climate, because climate is you want to start with the biggest gas users, which are your furnace and your water heater, most likely. But if you're talking about health, then it's start with your stove. Ideally, everything in your home is electric, and there's no source of gas in the home, and then there's no source of health or climate impacts in the house, depending on where you get electricity from. But yeah, I would say you want to consider what the priorities are and what you have available and what your remodeling and replacing budgets are and projects that you already have going on, because there's a lot of costs and economic considerations as well.
Yeah, and I'll reiterate something Dr. LaBelle said, which is that for most people, I think the consideration is what's the next appliance that needs replacing. With the exception of the stove is going to be, yeah, if health is your concern, that's the one to do. And otherwise, I would say stick with the next appliance that's overdue to replace, because it's too economically inefficient for most people to just swap them out randomly. You want to do it when one breaks down.
But you also want to have a plan in place before it breaks down, right? Because if you want to go from gas to electric, it's not necessarily straightforward every single time. So come up with a plan and then implement the plan when the time comes.
Yeah, well said. Definitely have to be ready, especially with some of those higher, or more complicated appliances like your furnace and water heater. Those can be challenging. All right. Well, thank you so much. Thanks, Eric. Thanks, Curtis. Thanks, Wesley. Really appreciate the great feedback and information today. We will send out a copy of the slides as well as the recording probably early tomorrow. Don't miss us for the other 4 webinars we have this week on natural gas and air quality. Look forward to having you. We're doing home air quality monitors tomorrow. And yeah, a huge appreciation for both of our presenters today, and we'll see you at the next one. Thanks all.
Thanks, everybody.